Back pain can be one of the most debilitating health problems, but a new minimally invasive procedure is helping relieve the pain.
A woman in Rosenberg is one of the first in Texas to receive this high-tech treatment. Arlene Velez-Diaz is a loving grandmother who can finally enjoy time with her grandson after suffering severe back pain for years.
At some point, I wasn't able to walk. I wasn't able to take care of myself. I needed help getting to bed, getting out of bed, take a shower, use the restroom. It was really, really depressing. I was devastated. I have a 4-year-old grandson that I couldn't even have him with me on the bed because it hurt so bad.
That's when Arlene turned to Dr. Candice Burnett with Modern Pain Management for help. She even began creating mosaic art, a hobby to keep her mind off of severe back pain. Typical treatments like massage, physical therapy, steroid injections, and surgery didn't work. So she turned to an app-based platform called Intellis Spinal Cord Stimulation System. This involved getting a spinal cord stimulator implanted. Think of it as a pacemaker for the spine.
One of the advantages of Intellis is its ability to deliver DTM stimulation. So DTM stands for differential targeted multiplex. So this is the newer type of stimulation that studies have shown results in a significantly improved low back pain as compared to more traditional therapy.
I'm trying to picture how that works with once you get it implanted. Does it stay there for life, or does it have a shelf life, so to speak, and you have to replace it, or can it go bad? Like, what does that situation look like?
Yeah, another great question, and which is one of the advantages of Intellis, which is I have a sample of the battery here. So this is the battery that powers the device. And so 2 small wires, such as this one, are inserted into the spinal column, connected to the battery. And as you mentioned, it's implanted under the skin, usually in the buttocks. So it sends off signals that interfere with the pain signal. And that's what causes the relief of the back pain. So this battery actually retains 95% of its capacity at 9 years. So it's where traditionally in 9 years, sometimes we would have to change out the battery. We haven't seen us having to do that with this particular Intellis battery.
Arlene says it took about 6 weeks after her procedure to tweak the device using her remote to get the settings just right.
I would tell other people that are going through back pain that this is not like a miracle device where you go to 10 to 0. But it helped me around 70% of the pain I had.
The device was created for patients like Arlene with low back pain and with or without associated leg pain when other treatment options don't work.
Back pain occurs as a result of an injury to one of the structures of the lumbar spine. So that could be the nerves, discs, joints, or muscles. So with this type of stimulation, we see chronic low back pain from one or more of those structures.
Dr. Burnett also believes this cutting-edge treatment will cut down on patients relying on dangerous medications to relieve their pain.
We all know that the opioid epidemic is real, and it is a problem for our society. And so any options that we have that can reduce a patient's need for any medication really, but especially opioid-based medications, is very welcome and something that really does change the way we practice.
Dr. Burnett is hopeful the quality of life will increase for all of her patients, just like it did for Arlene. Now, just so you know, this device is FDA approved, so that means medical insurance will usually cover the cost. But it has made a dramatic difference in her life. She no longer has to just try to get by every day. She's able to live and enjoy each day, and it was great to be able to see her do that.
That is a great story and great for other people to know about as well. Thanks, Melissa.